Sure. So this was a retrospective review that we performed looking at all of the patients at the Mayo Clinic that had undergone nipple-sparing mastectomy for cancer and comparing those patients that had positive lymph nodes to those patients that had negative lymph nodes. The reason that we wanted to look at this question was that when we initially embarked on nipple-sparing mastectomy, the initial indications had been to limit it to patients with small tumors that were not close to the nipple and that were lymph node negative. And obviously, as time has elapsed and the practice has evolved, we have been increasingly doing nipple-sparing mastectomies on patients with node-positive breast cancer. And so as the practice evolves, it's always important to look back and see, is this a safe practice? Should we be doing more nipple-sparing mastectomy in node-positive patients? What are the outcomes? So in this study, we had about 58 patients who had nipple-sparing mastectomy for node-positive breast cancer, compared it with about 182 patients who had nipple-sparing mastectomy for lymph node-negative breast cancer. And really the results of the study were very reassuring that there was no significant differences between those patients who had positive lymph nodes and negative lymph nodes. In particular, what we were looking at was what is the risk of them having a recurrence in the nipple areolar complex itself. And there were no patients in the lymph node positive group that developed cancer in the nipple areolar complex. And then we also looked at the survival of the nipple, and did the nipple need to be resected intraoperatively or was it able to be kept, and all of the outcomes looked very favorable.